So hello, dear learners. I hope you're enjoying the course, the basics course that we are now conducting the live session for. So for today's live session, we have all the faculty members of this course here. I am Dr. Arista, as you know me. This is Dr. Sweety Suman. You also know her. We have with us Professor Madhumita Dobe madam and also
hello, good afternoon.
Taklikar sir. So before, we dig deeper into the discussion today, I'll just give a brief overview regarding the discussions scheduled for this live session. So as you know that there are 2 live sessions for this course, 4 weeks, 1 live session, again, the remaining 4 weeks, another live session. So for this live session, we'll be discussing the contents that we have covered in the initial 4 weeks of this course. So as per the contents that we have covered in the initial 4 weeks, we started with the history of health promotion, with the concept of health. Then we went on with the different, the IEC, BCC, these components. And finally, in the week 4, we also had a bit of discussion regarding the need assessment for health promotion and like this. So these are the basic 4 components that we'll be discussing in today's live session. So I think we will start our discussion here with Professor Dobe.
Yes.
So, ma'am, I would request you to start the discussion from your end, please.
Dr. Jha had already mentioned perhaps that in this
yes, ma'am.
portion...
Yes, ma'am. There is one question in the discussion forum about medical conduct.
So let's start with that because this is something very pertinent and relevant to what is happening the country over, and as students and participants in this course, I think we should all, and as teachers too, we should all retrospect and introspect into what really is medical conduct. Now, conduct in any issue is what is expected out of you when you are in a profession. What sort of behavior, what sort of attitudes, what sort of values, responsibilities, disposal of how you dispose your duties, and these are certain standard set up by any profession or any service, and people who are providing those services or are in that profession are expected to comply with those. So conduct as a student in a school, conduct as a student in a hospital, or as a doctor in a hospital differs. So, and we learn these codes of conduct as we pass along in our profession, as we move from place to place, and as we imbibe the values, the ethics. And now coming to the ethics, we all know that ethics has basic tenets of what we should do and what we should not do. Now, the concept of ethics in medical profession, particularly in health, rose from a lot of unethical things happening. So people were raising questions about why those issues should happen, just like now we are raising issues as to why should these safety issues not be taken care of. So this is how ethics came into being. We started off with, we all know about the Hippocrates Oath. The doctors who are there, who are they are quite well aware that though we don't now, in most places, we don't have formal convocations where we read out the oath, but it is implied that we do understand the tenets of that oath and go along with that. Similarly, when we do research, when we work with human subjects and non-human subjects, non-human participants as well, even animals have some rights which are to be respected. So these are, we all again know that there are 4 tenets which is expected. One is justice, treating everybody equally. There should be no differentiation based on any type of difference, be it in social class, be it in economic class, be it in gender. So this is something which is also part of our conduct. We have to treat everybody equally. Similarly, while doing any research, we have to see that the research addresses this issue of justice. Similarly, non-maleficence. whatever you do, do no harm. This also forms part of your conduct. If you do not know how to do something, it is better to accept and refrain from doing it rather than doing it in a wrong manner. So non-maleficence forms part of ethics in research and part of your conduct, medical conduct, which is expected. Now, beneficence, yes, the whole, when we are asked to write essays of why I want to become a health professional, we all very commonly say that it is to serve the nation. We want to do good for people. That forms the basic concept of these professions. So similarly, like in research, in your conduct also, try to do as much good as possible through doing things which do not harm and do good in whichever small manner you can. You should not go do anything which harms people and at the same time does. And of course, being these we've talked about justice, we've talked about beneficence, we've talked about non-maleficence, and those of you who do research in health promotion will again go into all these ethical issues. The other thing which I really want to talk about is that whether these conducts are appropriately explained and practiced. Conduct is something which you acquire through practice. You look up at people who are your teachers, your role models, see how they behave, and that's what you acquire in life. So, as teachers, we do have a responsibility of following proper conduct. As students, you have the responsibility of choosing role models and people who are following proper conduct. And I think strongly that it is high time that we introduced some of these softer skills into the undergraduate curriculum and evaluate them from time to time, both formatively and summatively, so that such conduct becomes a habit. So medical conduct, we just can't put it down as 1, 2, 3, 4. It depends upon different situations. It depends upon whether you are in academics. It depends upon how you are performing your services. It depends upon many more things, I would suppose. And it's not only about doctors, it's about all professions everywhere who are involved in improving the health of people. It can be down at the community level also. Even the community level worker has to follow certain conduct, which is expected of them. So let's think of medical conduct seriously now, see how we can acquire the proper values, attitudes, skills, etc., and perform ourselves and dispose ourselves in our profession in a better manner. So I think I just have to say this much for
now. Thank you so much, madam. And to the learners, if you have any question, then please post that question in the live chat. Till now, I think we do not have any question right now. And we have
Dr. Sweety, since you know, and Dr. Lahiri as well, that I'm out of country, so can I take leave right now? Okay.
Yes, ma'am. Yes, ma'am.
Thank you.
Thank you. Yeah. Good afternoon, sir. So we have Dr. Chandrasekhar Taklikar, sir.
Good afternoon.
Yes, sir. Good afternoon. So, sir, the learners, and we would like to know something about, the major differences between IC, BCC, and SBCC with examples.
Yeah, for example, if you see, say like infant mortality in our country, right? So there are various causes for the infant mortality. So what we can do? So whatever the causes are there, so we can do the health education. But if you see the underlying causes, like for example, the early marriage, child marriages, these are like basic social causes, right? So for like say like IEC, what you call it, basically that started with like health education. So we can just tell about the infant mortality, what are its causes, and prevention and all that. But that's not going to solve our problem of the exact infant mortality. So to solve this problem, we need to identify what are the social issues. So, for example, one of the social issue is the child early marriages, and this is the social norm in various parts of India. So, if you want to address the infant mortality, unless and until these social causes are eliminated, we cannot control or we cannot reduce this infant mortality. So, therefore, the communication for changing this social whatever norms are there directed towards this, that will actually lead to the reduction in infant mortality. So that is called as an social and behavior change communication that can actually control your infant mortality. Yes, thank you.
Okay, thank you so much, sir. And is there any question?
No, not yet.
Not yet.
Yeah. Okay. Right. So now we move on to further discussions. We were discussing regarding the basics of health promotion and education interventions. So we started our discussion with the basics of medical conduct, because we had a question regarding medical conduct. And yes, interestingly so, medical conduct more so than ever has become a very important concept for us to understand whoever is going to practice health promotion and education and whoever is going to perform any kind of research with that. So we had a discussion on that, and the bread and butter concept in health promotion and education regarding the IC, BCC, and SBCC. These are the central and core concepts of health promotion intervention. So we were also discussing regarding those. Now, before we discuss a little bit on the health literacy concept, which we eventually discussed in the second week of this course, I would give all the learners who are currently watching this session a brief overview regarding the exam patterns, because perhaps this is the most frequently asked question in the discussion forum. So I'll just briefly give you an overview regarding how we are planning for the exams to be conducted. The exams, you all should have got the information by now that for this course, the exam is going to be a computer-based exam, and you'll be given certain multiple choice questions. So basically, you have to choose the best possible option which fits the context from the 4 options that is given to you. That is the correct answer for that. And you have to just do it in the computer. Okay, so that is a computer-based test. Now, the questions that will be asked in the exam. So be very certain to go through the assignments that you have been given, the weekly assignments that you have been given, because you will have a substantial number of questions from the weekly assignments, although they will not be exactly same. But if you go through the weekly assignments in a very rigorous manner, you will very easily crack the questions that are there in the final exams. There will be a different set of questions, approximately 30 or 40% questions will be there, which you will have in the final exam, which will be not there in your weekly assignments, but they will be there from the topics that we have covered during the 8 weeks of this course. So for those questions, what you need to remember is that you need to go through the slides, specifically, the major important slides, the key slides that you have already understood from the lectures, and the summary slides. Right. So the summary slides will basically give you an idea regarding which concepts for that particular lecture is the core concept or the particularly important concept. So very well understand those concepts, and you will have most of the questions from these basic core concepts and the questions that you will face in the weekly assignments. So I hope this clears the doubts that you have and you have asked in the discussion forum. So now I would go on with the discussion.
So we just found one question that does babies less than 1.8 kg and less than month included in IMR? See, first of all, this question is not directly related to our course. So first thing, you have to understand that IMR is the infant mortality rate. Okay. So infant, it can be under 1 age. So you have mentioned less than month. So yeah, infant mortality, it can be under 1 year of age. And infant mortality rate, I think most of you know, is number of deaths, per 1,000 live births. We have one definition, who are under 1 year of age. So under 1 year of age and less than 1.8 kg, I didn't get it, and we didn't get it that.
No, probably.
Why did you mention about the body weight of that child? Because
Yeah, probably 1.8 kg means, I mean, this is low weight
Low-
for age, okay, or we call it simply as underweight. So this is not directly related to infant mortality rate or infant mortality perhaps, but yes, having a low weight for age is related to the infant death or even the child death. So that is related, but that is not IMR. IMR means it is particularly related to the duration or the age of the child. Okay. So anyways, that was regarding the question that was being asked. But now I guess, now I guess.
there is another question in the
Yeah, so
live chat that out of syllabus, any question
yeah,
comes.
so no, the questions that
No,
will be asked in the final exam, they will not be out of syllabus or the content that we cover in the lectures. Okay, so just go through the lectures, the slides, and the transcripts that you have. All the concepts that we have covered, it will be enough for you to appear in the exams and go out with the flying colors.
Yeah, any more question in the, if you have any more question, then please write it down or you please post in the live chat.
Okay. So now we were discussing regarding the contents of the second week. So in the second week, we basically discussed regarding the concepts of health behavior, the concept of health literacy, and like this. Now, we do have a bit of confusion regarding the concepts of health behavior from the questions that we keep receiving in our personal emails as well. So, at the very beginning, you need to understand that health behavior means it is the behavior that is related to health. And behavior perhaps simply is understood by the concept that it is doing something, right? So how do you behave? Now, how do you behave means given a particular situation, what do you do? So in simple terms, it is doing something given a particular situation. Now, so if you consider health behavior, so it means the situation is related to health. And mostly, typically what we have understood from the concepts of health and well-being and deriving from those concepts, what we have is the health behavior is basically important for promoting health. Promoting health means improvement of health. So the health behavior, the particular term health behavior, is in fact directly related to betterment of health. That is why if you have gone through the slides of the lectures in the second week, initially we started with the concepts of health promoting behavior. So the idea behind that is whatever health behavior we discuss, that the performance of the health behavior or a particular individual who is undertaking that health behavior, who is actually doing that particular thing, is focused on improving his or her own health. Now here comes the question. The question is, if health behavior is so inclined with the concept of improving one's own health, then how do we explain the behaviors like risk behaviors of the adolescents? For example, if you consider a school-going child, we often see that a child with a bicycle is riding very fast, or even a child with a bicycle is not maintaining the signs, not maintaining the signals and anything, and just going on and on. So what happens is this is making that particular individual prone to accidents, which will cause or which may cause bodily harm and which may ultimately lead to hospitalization and other sorts of ill health. that we call simply ill health. So is this particular behavior a health behavior? In a broader context, we call it, yes, it is a particular health behavior, but it is not the typical health behavior as we know. It is considered a health risk behavior, because this particular behavior, that is riding very fast or not maintaining the signals, these are exposing that particular individual to ill health or the probability of having ill health. Why we call it as the probability of having ill health? Because not maintaining the signals or riding very fast in this given example, it is not necessarily sufficient for that child to meet with an accident or have some bodily harm or something like that. But it definitely increases the chance of it. And once there is any, in any event, or there is any harm, or there is any event of hospitalization like this, so that means that is an ill event or an ill health. So this behavior is exposing the child to an ill behavior, ill health, right? So ultimately, the concept, we also have a question here regarding the same, that health promotion and risk behaviors come under health behaviors. So yes, so ultimately the concept of health risk behavior is within the umbrella of health behavior. But typically what we understand from the term health behavior is how people do certain things, or what are the people's behavior regarding promoting health. That is the usual notion. But for a better understanding, we should also consider that health risk behavior is again a component of health behavior. And in what way? In a way that to improve the health of an individual, or to improve a particular health behavior, or to improve a health promoting behavior, you need to get rid of the health risk behaviors. That is why, if you remember, in a summary slide, we have mentioned that the health promoting behavior and the health risk behavior, they are the two extremes of a particular spectrum of health behavior. Now, typically in health behavior, we consider sickness behavior or, or health seeking behavior like this as the typical examples of health behavior. But you should also consider this, that these examples or these components of health behavior that we usually consider are context specific. For example, the sickness behavior means when a particular individual is sick, what does that individual do then? Now, for example, care seeking behavior means what does a person do to seek care? Now, there may be a substantial overlap between a sickness behavior and care seeking behavior, because a person may not be sick to go and ask for some health care. Typical example is vaccination. Again, a person may be infected with some disease to go out and ask for, to go out and ask for certain medicines or something like that. So that may be a care-seeking behavior as well as a sickness behavior. So that is how they are linked. So the main point that I am trying to emphasize over here is that the contexts differ. So similarly, for health risk behavior and health promoting behavior, here also the context differ, but they both come under the broad concept of health behavior. And remember that health behavior and health seeking behavior, they do have a subtle difference in them. Health behavior means the broad idea or the broad behavioral context that we are discussing regarding health. But health seeking behavior is more closely related to health promoting behavior or health promotion behavior, because health seeking behavior mostly relies or mostly focuses on the concept of having or practicing something that leads to good health or that leads to health. Okay, so that is how health seeking behavior is mostly related to health promoting behavior. Now we do have another question in the forum, like
equity of health. I think
right.
health equity.
Improvement of health. Yes, health equity. So are you going to?
Yeah, improvement of health. How it differ? First of all, improvement of health, I think it's a very common term that your health is improving. Maybe the question is not clear much. And if you talk about equity, okay, in public health, health equity or equity is like who needs it most. Like, there should be fair treatment, fair selection. So the person or the group who needs a particular thing most, so that we have to keep in mind. You want to add something?
Yes, it's fine. See, the equity of health and improvement of health, as we were discussing right now, is regarding, the same thing. Improvement of health means you can improve the health by means of promoting certain behaviors or reducing certain risk behaviors and something like that. So improvement can have many different forms, and there are different ways of improving in an individual's health or a community's health like this. And equity of health or health equity, in whatever way we put it, it is more a holistic concept, and it is more a group concept, because you cannot achieve an equitable health unless you consider health as a group phenomena or a community phenomena. So what Dr. Jha mentioned was equity means equity is not equality. I hope that is clear to all the learners by now. So equality means you give something equally to everybody.
To everyone, you give the same thing equally.
Equally. And equity means you give something to somebody in proportional manner. Whoever needs it more, you give it to that or those group more.
Those who need it most.
Right. So in order to understand who needs it most and who needs it comparatively in a lesser amount, you need to have the whole picture or the situation of a community. In a community, I'm giving you a very, small scale example. So in a community, what you have is a group of people, and in a group of people, each and every individual will have different needs regarding health. So when each and every individual is having a different need regarding health, what ultimately will happen is the input, the external input that we need to give to that community so that everybody achieves a certain degree of health will differ. Now, this difference is there because the individuals are on a different level. So the ultimate thing what happens is you give different inputs to different individuals to achieve a certain level. And the level that is achieved is the improvement of health. So what happens is, for example, the health promoting behavior. For example, the vaccines that the individuals take. The vaccines may be given to all the individuals in a simultaneous manner. So that is how the people are taking the services, and that is the improvement of the service of the health of the community. And equity, on the other hand, you can consider there is a particular group of people, for example, who are not willing to take the vaccine, but the service is there. So there, the service providers are giving extra impetus so that the people take up the services. So that extra thing is ensuring equitable health, because the vaccines are needed. And unless and until we ensure a same degree of vaccine coverage, we cannot ensure good health for the community. I'm just giving you examples in lay terms so that everybody is able to understand. Now, I guess this is regarding the equity and improvement of health, and regarding the the health behavior and everything. We do have another question, but before we move to that next question on the ABC model, I will just discuss very briefly regarding the health literacy part. So now the health literacy, why I want to discuss regarding health literacy is, all the learners should have a very clear understanding of health literacy, because it is not the same as the concept of literacy. A concept of literacy means a person is educated, literate. There are different anecdotes, and there are different concepts like what do we say if a person is literate? Is the person educated? If the person is educated, if the person is literate? Like this, we often say all these things in our daily lives. But health literacy is something similar in terms of literacy regarding the health aspects or regarding health behavior. So health literacy does not necessarily mean that an individual or a person is able to read or write anything. For example, a poster related to, a health issue, for example, malaria. Now, we are currently undertaking one such research on malaria. Now, there are different health promotion materials. What Professor Taklikar has said that IEC often includes having certain materials. Now, if a person is able to read that material or whatever is written in that poster, like keep your surroundings clean. This is mentioned in one of the health promotion materials. Now, the person is able to read that, but that does not necessarily mean that the particular individual is health literate. A health literate person means who is able to understand what is good or bad regarding his or her, community's health or maintaining the health of his near and dear ones, perhaps. So this is the concept of health literacy. So health literacy goes beyond the typical concept of being able to read or write, right? And regarding health means particularly for improvement of health. So this obviously includes whether that particular individual is able to focus on the knowledge or the others' behavior. That means the social interaction part is also included. So health literacy ultimately is a concept which depends on many other things, but ultimately again will lead to successful practice of health promotion behavior or reduction in health risk behaviors or risk-taking behaviors. Right. So now I guess we can discuss regarding the ABC model.
Yeah, there is one question regarding ABC model. So I think it is about antecedent behavior consequence model, right?
Yes, so.
Because person, I think his name is Ajay, yeah, Ajay K. So he has just mentioned ABC model and not the full form of ABC. So I hope regarding, we were discussing about some health behavior and some health behavior change, and regarding this particular health behavior change. So ABC is antecedent behavior consequence model. So it's a very simple thing. We all know, which happens every day, is happening with us, with everybody, that antecedent is something ABC, antecedent behavior and a consequence. Now the thing is, what is antecedent? We all know that it is something that comes before. For example, it comes before a behavior, a kind of trigger. Okay. Then comes a behavior. So behavior is like any individual is doing some action. And C is about the consequence. Consequence is something which follows the behavior. What will be the consequence of that particular behavior, or what is going to be the consequence of that behavior? So this is ABC model. Although it's a simple thing, we all know. And so I think it is clear. So if you have any further question, you may ask. And do we have any more questions?
Yes, we do have. We have another question.
Where can we get FAQs? Huh?
Okay. So
frequently asked questions.
Yes.
And there is somebody who is asking, can we get previous year's question
that
paper?
is available. If you're not able to see them, I mean, you should write to the, the given email ID regarding NPTEL technical team and everything. That is there in the course page. Okay. I think the previous year's question papers are available. You can just write it to the NPTEL email ID that is provided with the course page. And FAQs, particularly, there is no typical section of FAQs as such. The section that is there in the course page is regarding the discussion forum. So the question and answer section is there. So you need to register with the discussion forum, when you register for the course. And there you need to write down your question, and it will come to us in an email format, and we'll periodically give you responses based on the questions. Now, there is another question regarding what are the barriers in health literacy. So now this is a very interesting question. The health literacy barriers are, these are all the barriers that we consider for an individual to have a good health, right? Because see, in a broader concept, health literacy is one of the very important determining factors of an individual's health or a community's health. So in terms of health literacy, the first big barrier that you can consider is the level of general literacy. Because if an individual is even not able to read and write, there is only a slim chance of a particular individual to understand what is being displayed or what is being said or told to that person. But lack of literacy is not perhaps the only barrier for health literacy. And in some instances, as we have often seen in our field visits and in other situations, is not the barrier for having a good health literacy. Because there, what happens is people are able to communicate well with other individuals. The health workers, they communicate well. They perform a very good risk communication. They make the people understand what are the risks of certain behaviors and how certain, good things can be achieved and good behaviors can be achieved. So the next big factor is the communication part. So first was the level of literacy. Next was the level of communication. And the level of communication, again, even if a person is not able to communicate well in terms of certain health issue. Now consider this. If we are not able to discuss freely with somebody or even amongst ourselves regarding some certain health issues, what will happen? We are not going to be able to have a clear-cut understanding. So perhaps the standout barrier for health literacy is not being able to have a good health communication. Now that health communication may be for health promotion, that health communication may be, simple risk communication, anything. But that means the focus here is on communication. Now, again, there are different barriers for communication. If you remember the SMCR model, that means the sender message, the channel and the recipient or the receiver, the simple model of communication, all the barriers that are there with the SMCR model, that those behaviors are again barriers for, for this health literacy. Okay. So I think this is clear that, the major barriers for health literacy can be considered in two major ways. First is regarding the general literacy, and the second one is regarding the barriers of communication. Then there are different other barriers, like some social norms can create certain health barriers for health literacy. Because even if the individuals are willing to understand something or logically are convinced of something, still certain norms or certain prejudices or preoccupied notions may convince them otherwise. So that will again lead to a lower level of health literacy. Right? Okay, so we do have.
And I think Taklikar sir
yeah.
will.
We will now go to Professor Taklikar sir.
We will
yeah.
collect the meeting anyways. Sir, if you have anything to say to the participants or to the learners, then you can say. Yes, sir, can you hear us?
Yes,
Sir, if
yes,
you have anything to say to the learners, then.
Yeah, it is not a very difficult exam. So it will be like multiple choice questions. And if you go through whatever has been discussed and whatever is put into the website, and if you answer the practice your assessments, so obviously it's not that difficult. You can manage it. So you can use some time to it, and it will be easy for you to appear and get through this exam.
Okay, thank you so much.
Thank
you, sir. Thank you. Now, I would like to say a few things to the learners. See, as a public health specialist or as a public health professional and as a health promotion specialist, one thing we have to keep in our mind that we have to always consider about the social determinants of health, right? And by now, you all know that social determinants of health are some non-medical factors, but which can influence our health outcomes. It can be income, education, the physical and the social, the contextual environment that we stay, etc. So these are the things that you have to keep in mind. And apart from that, if we talk about, now we'll very briefly, we'll discuss two models. The first, the very, the basic one, I mean, the two health behavior models, you can say. The first one is the individual level model, that is health belief model. Okay. Now, regarding health belief model, by now you are clear. I know that, yeah, you have learned regarding that, what are the different constructs of health belief model, but let's discuss. So, the different constructs of health belief model. So we have perceived susceptibility and perceived severity. First, let's discuss the first two constructs. Now we can take one example like screening for breast cancer, or we can also take another example, the screening for cervical cancer or cervical cancer screening. So like, the breast cancer screening. So perceived susceptibility, you all know, or you can also say perceived vulnerability. Now, it is about how much a person, his or her perception, or he or she perceives that he or she can get that particular disease, that contract that particular disease or illness. How much he or she is susceptible or vulnerable to acquire a particular disease, like here, breast cancer or the cervical cancer. Apart from that, we have perceived severity, that it is the perception or belief, you can say, that that particular cancer, a disease, what will be the severity of that particular disease? Death, disability, etc. So what will be the consequence or seriousness or the severity? We often, discuss the severity of a particular illness. Perceived benefits, you all know that there is another construct regarding perceived benefits. So it is about that if I am going to, undergo screening or any kind of precautionary or preventive measure, you can take many examples. So actually a person can believe or perceive that that particular measure, the preventive or precautionary measure, how much that particular preventive measure will be effective in reducing the disease threat. Okay. So what benefits? Basically, what benefits they can get. Then we have perceived barriers. You all know that, you'll often go to the community, and if you go and discuss with them that why don't you go to that particular health center and undergo screening, and you will come to know different barriers, different challenges of the community. So it can be, it is time consuming, or, it may be expensive sometimes, or it's very inconvenient. It's too far. Maybe the health center is too far. The hospital is too far. There's nobody in my house, in my home who can take me to that particular center. So there can be different barriers. Here I have mentioned 3 or 4 barriers, but it can be anything. It depends. Okay. Cues to action, it is a kind of stimulus, you can say. Okay. Like we often, see different social media, or we see news media, or different, you can see, in fact, some IC material also. So some kind of stimulus which trigger up to decide, the decision-making process to accept a particular health action, a particular preventive measure. And self-efficacy, this is very important for you to understand what is self-efficacy. Self-efficacy, that we understand. What do we understand by self-efficacy? Self-efficacy is about a person's confidence. How much he or she is confident that he or she can perform a particular behavior, or he or she can go and undergo a screening, can avail a health service, can, like in COVID, like he or she, how much he or she is confident that he or she can wear mask regularly whenever outside. And also in self-efficacy, you have to remember another thing. Yeah, definitely it is about a person's confidence that whether he or she can perform a particular behavior or not. Also, you have to remember, which is very important, that how much a particular person is confident that he or she can overcome a barrier if some barrier comes, so if he or she feels or perceives that, yeah, this is a particular barrier to perform a particular, to successfully perform a behavior, so how much he or she is confident that he or she can overcome that particular behavior. So HBM is very important. Definitely you have attended the lectures. Okay. And not only HBM, I have discussed different health behavior models. So go through the different health behavior models. Okay.
Right.
So yeah, Dr. Lahiri.
So yeah, we missed just one more question. I think now we are clear that your ABC model that you are talking about was regarding the ABC model of attitude, right? So you have specifically now mentioned regarding affect, behavior, and cognition model, right?
Yeah,
so that means
you should have
ABC model
mentioned the full form, because ABC is also about antecedent, behavior, and consequence.
Right.
Anyways, we can
it's
let's
somewhat similar. So what happens with ABC model is, see, I don't know, I think we cannot share the screen. So if you have the lectures with you, I will ask you to go to the example.
I think what you can do, Dr. Lahiri, you can just mention the lecture number and the slide number.
Yeah, it is the first lecture of week 2. You should go to the example. Why I'm telling you is, see, in the attitude part, now attitude, basically what happens is, whatever we are going, to perform anything, if we are going to take the vaccine or not, if we are going to drive slow or not, something like this. The actions that we are basically performing, it has a component where, how do I put it? Where our inner self has given some sort of signal on doing that thing in a specific way. Now, this signal is specifically different from what we call a motivation, because a motivation is something that makes us do things, but once our inner self is preparing for us to perform certain activity, that forms the concept of attitude. I'm just giving you in a very loose terms, because we have discussed the theories a lot in the lectures. So I just want to make it a bit more loosely understandable so that the concept is clear. Now, so do you have any? No, there is no more question. So if you go to the ABC model of attitude, you can see that we have mentioned firstly regarding the affect, next regarding the behavior, and finally regarding the cognition. So what is affect? Affect means how a particular individual or whoever is going to perform a particular behavior is feeling about that thing. Apart from, now, after feeling, what comes is particular action, that is the behavior component. And even after behavior, what comes is a particular individual's perception of what may be the outcome of the behavior. So that is related to the cognitive component. Okay. So the affect, it leads to the behavior, and the behavior finally leads to the cognition. Now see, if you consider these three in tandem, ultimately what forms is an individual's inner feelings, or that particular inner signal regarding whether that particular behavior should be performed or not, or that particular thing should be performed or not. Take, for example, taking vaccines. A particular individual may have, a feeling of fear regarding the needles, right? So that will ultimately form the affect component. So because that particular individual is afraid of needles, but the vaccines, you cannot give a vaccine without a needle. So that is one consideration. Then there is the behavior component regarding the, particular action of taking the vaccines. It may be so that the person has initially had an event of fainting while taking a vaccine. So that is again a negative phenomena which is leading that particular individual pulling back from taking the vaccine. And finally, there may be another phenomena if the person is conceived that, okay, vaccines may be taken or may not be taken, then the knowledge of whether the vaccines are effective or not, that means how much does that individual know about that vaccine? For example, some of the individuals say that the COVID vaccines are not effective, and some didn't even take the vaccine. So here the ABC model really comes into play, that the cognition is basically hampering that individual, to not take the vaccine, and how that not taking the vaccine is actually taking place. This is a negative behavior, and how this negative behavior is actually taking place because of a negative attitude, which is formed from the affect, then the behavior and the cognition. Okay, so I mean, I think this is clear, I guess. So now we are almost
clear. Yeah. And just a few seconds, I'll take few seconds that we, we also discussed about social ecological model. So please go through that model very well. A very robust model, very important model, I would say. Why, you all know by now that in social ecological model, we implement, we develop and implement interventions at all levels, starting from the individual to the interpersonal, to the community, to the organization, till the government laws, rules, and regulation. So, there are evidences, and it is assumed that if the interventions are targeted at all levels, then, the outcome will be much, much better than if we only target on one or two levels. Like, if you can even compare, you can conduct a study, like in a particular population, or you can see that you have targeted only individual or maximum up to interpersonal level. But in some other, group, you have targeted the intervention, you have implemented the intervention at all level, individual, interpersonal, community, organization, and the government laws and regulations, the policy laws and regulation. Then the outcome will be much better. And, so this is very important. And please go through this model very well. In my lecture, you must have, we have discussed very nicely about ACM model, that is social ecological model, with examples. Okay, so go through that model, and definitely learning is okay, but I always believe in learning by doing. So now you have the different concepts of theories and models, and by now there are many things that till like week 4 we have discussed so many issues and topics. So what you have to do now, you have learned, so theoretically but practical implication, that is very important. More you do, the better you learn. So remember that you have learned. Now, as a public health professional or as a health promotion specialist, you can apply your theoretical knowledge practically. So practical implication is very important. So keep this in your mind. And I think...
I think that will be all for this particular live session.
Yeah.
So we'll see you in the next live session. Till then, if you have any questions, please do post your questions in the discussion.
In the discussion forum, right.
Okay, thank you.
Okay, so thank you to all the participants. Thank you for attending this live session. Thank you.